episode of Voices of Inclusive Research podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today you will hear the voice of Miss Stephanie Monroe. Stephanie has 40 years of career advocating experience working to seek justice and fairness for all. She is the president of Renwood Group, a DC-based consulting firm focused on health, education, and social inequities. I am so excited to talk to Stephanie today for her to share her knowledge with us. And so let's get started. How are you doing today, Stephanie?
I'm doing wonderfully. How are you?
I'm doing well. I'm doing well. I'm so excited to finally get a chance to talk with you. You're definitely a powerhouse in this world of health equity. So I'm so excited. And so I want you to share with our audience who you are, a little bit more about yourself. I know I just introduced you, and why you do the work you do.
Sure. So I'm Stephanie. I'm from Baltimore originally. I went to University of Maryland and then University of Baltimore for law school.
Okay.
And I worked for about 25, 30 years on Capitol Hill in the U.S. Senate, where I was a senior staff advisor to the Senate Health and Education, Labor and Pensions Committee.
Wow. Okay.
Through that, we've worked on many of these issues across the lifespan. I've done a lot of work around social programs to help communities that needed a hand up. I've worked on education programs. I've worked on health programs, hearing from communities, hearing from people, their stories. And we shape legislation based on that truth.
Awesome.
So having people come in and have access to staff is really important. I always encourage people, you've got to make your voice heard because people, especially people who work in Capitol Hill, they don't know.
Right.
Many of the members of Congress, I've never held a real job.
Yeah.
It was up to people to come in. I then worked for Us Against Alzheimer's for 13 years.
Mm-hmm.
I went in and I heard former Justice Andrea O'Connor speak about her husband's battle with Alzheimer's. And this was after I had left the Senate and was just very surprised to hear about these disparities in Alzheimer's disease because all during my time on the Hill, no one had ever come in and lobbied us about that issue.
Okay.
And back when that was happening, which was around 2010 or so, Alzheimer's disease in terms of research was only getting about $400 million a year, which frankly is nothing. We're now over, I think we're over 6 or 7 billion as people's, again, their voices, and we've been able to talk about this. But between my work on the Hill and then my work with Us Against Alzheimer's, I was nominated by President Bush, and confirmed by the U.S. Senate unanimously to be the Assistant Secretary of Education, where I ran the Office for Civil Rights.
Awesome.
Again, that through line to what does civil rights look like for children with disabilities, children with these high needs, racial discrimination, and things of that nature. And what I began to see before we had the official name of social determinants of health, that health and education are so intricately linked that you've got to address all of those things. We need good health. We need the social determinants or the social drivers of health to all be addressed together. So education, and in fact, we're now seeing in Alzheimer's disease that a person's reading level can be a very good predictor of whether they are going to have a higher prevalence in Alzheimer's.
Wow.
So all of those boats and learning more about the impact through research and through good data.
Yeah. So thank you so much. I mean, so much work you've done. This is so rich, the knowledge that you have. And so, yes, this social determinants of health, I was just thinking like, that's like a new term that kind of came into play within the last few years. And so you saw that happen.
Right. Absolutely. Holistically, people really willing to say we're whole people. We're not divided into little separate quadrants, right? And so we know even with Alzheimer's disease that it's not just about the brain, it's about the chronic conditions that lead to your brain having challenges, and that we have cognition problems sometimes that start very early. So we know it's from twinkle to wrinkle, we often say it. It's important how we work to develop a child's brain, even in utero. All of those things, not just social determinants, have an impact on how well people will age. Access to good preschool and childcare and parental care. So many parents don't realize that Even when their child is not speaking, they are intaking words and processing those.
Yeah.
And that can really impact so much. And then we see later in life that can impact their health literacy. How
Yeah.
much do you understand about what is good for your health? What's good for your heart is good for your brain. How do you incorporate that? And it's important for doctors to make sure that they are communicating these things in ways that people can hear that and access it. This is not a time, I've actually told doctors, this is not a time for you to try to impress your patients with your knowledge. It's a time to really break it down for people in a way that they can absorb it.
And that's exactly what we really take pride in at Diverse Research now is bringing science really to the community, bringing research to the community and breaking it down to them on the level where they can understand. So then they're not so hesitant of getting involved, right? So they actually have this knowledge. They are informed where they can make informed decisions to get involved. Share with me, I know you had mentioned what's important for you is like these stories. You over the years, the stories in the community that you've heard, and I'm sure you've had these impacts. Do you have any stories you can share from the community or like anything that you've learned while you've been doing the work?
I have learned when I first started doing this work that it was really important for people to not feel ashamed
Mm,
about symptoms that their loved ones
right.
were beginning to see and understanding them, the difference between mental health
Mm-hmm.
and brain health. They are related, but they're not the same.
Okay, that's good.
Unfortunately, I'll say, or fortunately for my work, the best story I can tell you is the story of my personal life, where
Mm-hmm.
my father, after I started working, 3 years after I started working at Us Against Alzheimer's, he was diagnosed with vascular dementia or mixed dementia, came in sort of as a typical person with some memory challenges. He started having a couple more accidents and things like that,
Mm-hmm.
being a little forgetful. And at that time, there was no place to really go. I felt like it
Okay.
for a really thorough thing. I had to fire two doctors because
Wow.
it was just normal aging. And I was like, I know my daddy, this is not normal. Daddy makes rice pudding, and if he can't remember the recipe, that's a problem.
Right.
It's something that they're used to doing a lot. More
Right.
than just
And
everyone
now
has
it's a
moved to their
change.
PEs. Yeah.
Yeah.
So we finally, third doctor in, were able to find someone who actually ran the test. It's called the MMSE test
Yep.
on him. And actually, when he was running the test on him, even at that point, because I'm sitting right there, and of course, feeling very defensive that my dad couldn't answer certain questions. And I began to see, like, this test seems like it's more of an IQ test. You know,
Mm.
my dad was educated in the segregated South and dropped out at seventh grade. So
Okay.
when he would respond to things like, I don't know what that animal is. I was
Right.
working two jobs to keep my family. I didn't have time to go to the
Exactly.
zoo and find these.
Exactly.
So it
Yeah.
wasn't really measuring it well. And the doctor, he barely looked up from his tablet. And I had to ask him at one point, can you look at my father? Because they were diagnosing him with severe Alzheimer's. And I'm like, well,
Mm.
look at him, talk to him as a person. And when
Right.
he did that, he says, well, it looks like it's probably, he didn't do well on the test, but he's probably more to mild stage. So even these tests
Yeah.
need research participants to validate the test
Yeah.
that they use for different populations
Yeah.
because, we use the same test for someone who's a white collar worker as a blue collar. If dad doesn't know what a hammer and a saw is, and that's something he works on a lot, then that's a problem.
Mm-hmm.
Doesn't know how to subtract by sevens, that might not be as much of a problem.
Right.
Yeah, right.
Exactly.
So we got to
I,
work on it. We need people involved in research,
yeah.
all different aspects.
That's a good point to have different like levels of these tests.
Yeah,
We don't have that right
we
now.
don't.
They're
We
pretty
don't.
standard. The MMSC is definitely still the gold standard kind of
Right.
in that space. So I love
And
that.
yeah, and we also found that different populations take view tests differently. We
Hmm.
found that, African Americans, even on the SATs, these are all the same
Right.
issue of validation. It's very important, it seems, for many people who are African American and Latino to be right. So they will take longer time to complete these tests, which are
Hmm.
timed, which
Hmm.
means we may not complete the test at the same speed that
Exactly.
another person might. Because the other people, they just want to get, they know they're going to be right. So they just zip through it.
Hmm.
So again, if it's about knowledge, let people have more time to see if they can pull that information out.
Yeah.
That's a whole nother conversation.
Yeah.
We need to
I
look
know,
at
right?
how we're measuring. But anyway, my dad lives with me now. He
Uh,
has, I guess he's in about his 15th year or so with Alzheimer's. He's
wow.
no longer mobile, but
Okay.
he's not aggressive. He does talk. Yesterday, he just told me, I asked him, I said, "Do you want me to put on the vibrator on your recliner chair?" And he looked up just straight dead in my face and he said, "No, I don't want you to do that." I was like,
Okay.
"All righty
Okay.
then."
That's
Right?
right.
But he laughs and he's jovial. We're blessed to have wonderful caregivers
Awesome.
topic because it's expensive
It
to,
is.
to
It
provide care
is.
for our
That's
loved ones.
oof, hitting on so many, so
Yeah,
many important topics, I tell you. But we're both very passionate and we both worked in the brain health space. That's kind of where we met in that space, Alzheimer's research space. What is your opinion or your take on what's happening in the field right now with the discovery of amyloid plaques and these drugs that are supposed to decrease the amyloid plaques in the brain? And I know there's a lot of research that are trying to get more diverse populations in those type of studies so we can really see what's going on. Because what I've heard from people that from talks that I've had is that Alzheimer's is looking different in Black people or
yeah,
people of color than white people. And Alzheimer's, I mean, and the amyloid plaque, or I guess you'll see the amyloid plaque in both brains, but we still are not understanding, I guess, the cause
exactly.
of the buildup, and it might be different causes in the different groups.
Yeah, I
Um,
mean, I won't say I'm a skeptic exactly, but
yeah,
I do think that there needs to be caution trying to, I mean, first of all, most, not, about 97% of the people who are being researched on are white, predominantly men, people of European descent.
still,
Still, we're doing better in some studies,
yeah,
which is wonderful.
yeah,
But what we have seen with the amyloid, when people are willing to talk about it, when scientists don't feel that even at scientific conferences that should be driven by truth and by data, I think they're felt a little bit dismissed
mm,
and a little shunned in their
mm,
research and challenged publicly. I had that experience myself
mm,
asking a question
yeah,
conference 2 years ago. But what we know and what we're seeing right now in various studies is that number one, everyone who has Alzheimer's has amyloid plaque,
yes,
but
yes,
only about 50% of people who have amyloid plaque go on to develop Alzheimer's.
right.
They used to talk about that a lot more. They're not talking about it now. And I feel as
Mm,
maybe we're looking for that silver bullet.
mm,
I think, like we learned with HIV, it's not going to be one medication or one approach. You may have an entire, it'll might be a couple of different medications to attack different things.
mm-hmm,
Know that it has something to do with vascular conditions. If you have high blood pressure, heart
yep,
disease, diabetes, either white or black, you're more likely to
yeah,
develop cognition challenges than others. But we are seeing that when some African Americans go in to be tested to get enrolled in a clinical trial, even when they have symptoms,
yeah.
amyloid plaque levels are too low for them to get into the
That's
trial.
what we've been seeing. Yes, I've been seeing
So
that too.
we need to follow the trail. If
Yeah,
it's the symptoms that we're trying to address, as opposed to preventing the symptoms from starting in the first place, we've got more work to do to
yeah,
really understand the causation rather than just the sort of coexistence.
yeah.
And we also don't know if you are lowering the amyloid, which is what the novel medicines that are out there now that cost like $26,000 a year
I
to
know.
buy
Again, a whole nother story.
accessible, all of that, that's an issue. But we don't know what happens when you lower potentially good amyloid, like good cholesterol, in people whose pathology may suggest something, but it's not causing the problem.
Mm-hmm.
There are people who believe that it's potentially that for African Americans, because we are very resilient people, from slavery forward
Mm-hmm.
here, we know
Mm-hmm.
that's to be true, that
Mm-hmm.
it may be a protective factor for us. So if we lower something that's good, it be causing problems somewhere else. So
Well,
we need more research. We
yes.
need more brain donations. And I know
Okay.
a lot of religious reasons why people don't want to,
Yeah.
but I just made a decision last week that
Yeah.
I'm going to donate my brain to science because I can't take it with me. It's not going
Wow.
to be used. They make me look still good like I got one. So
Oh,
I call
I
that out.
love
That's really
that.
important. It used to be that the only way a person could be diagnosed with
That's
Alzheimer's
right.
was through an autopsy.
That's
So
right.
we got to do what's right for us.
Yes.
Nothing in us, I say, without us.
Yeah.
So it's our own fault if we're not volunteering, but it's also the fault of companies when they don't reach out to us.
That's right.
The Black community, and I'll talk, about the Black community, we're not hard to reach as for years people thought.
Yeah.
Reach the hard to reach, come up with all these strategies. What are the barriers? Da 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 da. Found out through a play that I did throughout the country called Forget Me Not. We
Hmm.
went in and when we did this play,
Hmm.
we surveyed people. How many of you have ever been, your doctor has ever discussed brain health with you? 80% said no, never. How many of you would be interested in clinical trials if you found that you were qualified for it? 80% said yes.
Wow.
So there, the barrier is they're not being
They're
asked.
not being asked.
They're
Yes,
not.
I've heard this before as well.
Hmm.
Yep.
Hmm. So when we're willing and when the criteria that's set up for us to get in is really set up knowing how we are as people, it's designed to allow more people in from different race and ethnicities, we
Yeah.
can get in. It's like you invite somebody to the party, you say, hey, come on, why don't you come to the party? They come to the door and you say, oh, didn't I tell you were supposed to have white hair? So it's
Yeah.
like I went through all this time to get down here, gave all my blood, got my
Yeah.
ex, everything else, and now you're telling me I can't come in the door?
And you know what? Sometimes I've found that that is definitely a discourager
Then
of
you go back and what? You tell auntie,
yeah.
church, everybody.
Oh,
They
they
came
didn't want
all
me.
my
They
time. They didn't want us. Right.
Yeah, yeah. And I have found that this definitely discourages, especially our community, when they come and they are willing and then they say, oh no, you're not eligible or you didn't make it in. I don't, that's a kind of what I want to share. I want the message is don't get discouraged by that. The way that science, a lot of times these protocols are created in a way, which that's another whole story, another whole
Yeah.
topic, trying to make these protocols more, what's the word? I think you just said it, but make these protocols in a way or write these protocols in a way where more people can be
To
accepted
get through the
in.
door.
Now, the other thing that my idea behind all of this is, okay, they might not be able to get into the protocol, the main protocol, but what if we had like sister protocols, and I have seen that where you might have a sister protocol where if you don't make it in the main protocol, your data is still valuable and we
Right.
can put you in and we can still follow you. We can still see what's going on. I know it's expensive. That I know it would be expensive to have every study to have a sister protocol. But I think that would be so valuable because once people are engaged and once they are willing, I don't want to lose that. I
And
want
that's
to
why the
keep,
brain donations, they're not going to turn away a brain.
right,
So
this is true.
it's
Hmm.
everybody, you can have your brain studied, and it's really, really, really so important.
Hmm.
The other thing is people have to be willing to set targets. So it was during the time when I was working on Capitol Hill that the FDA basically allowed women into research. You
Wow,
know that the first breast cancer drugs were developed on men,
crazy.
but they said, we've got to get women in these protocols. We got
Yeah,
women in these researchers. Then they said we've got to have diverse populations in, but they never required it.
never required it. Yeah.
Continued to approve medicines that had 1%
Yep.
of non-white
Yep.
study and saying that's okay. And they didn't tell the public. They didn't put a label on there.
Right.
Us make a decision like, okay, you can take this if you want. It might be
Hmm.
safe, but we don't know. It's
We're not sure if
unproven.
it's safe for
You know?
you in
Yeah.
particular.
Or if it's going to do what you want it to do. In addition to that, I feel like there needs to be, the FDA needs to say, as the regulator, if you want a label that allows all people to get this, you need to produce that information. It needs to
Yeah.
be something that is actionable for people. I also think if, one of the novel things, I love the idea of a sister study. If you're having a hard time recruiting certain populations in, recruit those populations in first, right? Because
Okay.
a lot of the companies will say, well, okay, our goal is to have 2,000 people in this study.
Hmm.
And then they go out and they get 1,800 people who are white. There's only room for 200 of the Blacks,
Yeah.
Latinos, who happen to be twice as likely to get
To get
Alzheimer's as the white people. I hate to
yeah.
say white and Black, but let's just
Yeah.
say it what it is,
Yeah.
right? So
And
recruit us in first. If you say we're 20% of the people who have Alzheimer's are Black, 30%.
recruit the people first that are disproportionately affected by the
Exactly.
condition.
Right.
And that's with any condition.
Annie, 100%.
Yeah, I
And
like
then,
that.
and this conversation that we're having now, I mean, in our country about DEI, about race, about changing vocabulary, this really is a much more significant issue than vocabulary. I call it whitewashing data. A
Mm-hmm.
lot of times you're seeing companies and academic institutions, they're not even reporting the subgroup data, which is important. They'll just say white and non-white. Well,
Mm-hmm.
that non-white might be 95% Latino.
Yeah.
That's still a problem,
Yeah.
right? So letting the truth of the data come out, welcoming at a scientific conference, that's where you want people to be talking about their hypotheses and what they have seen and what they have
Yep.
experimented with. We need to do more of that so that people don't feel their research, their papers aren't being given the same value as
Yeah.
some others. This is a systemic issue, even in science, which is really unfortunate. It's going to affect our health and well-being. But I am excited because, we want to get to a place where people's age matches their brain capacity. So
Yeah.
that means going earlier than when a problem has started. So we're
Prevention.
talking those social determinants. And
Mm-hmm.
now we've got there was a pointer study that was just released a while ago
Mm-hmm.
that shows, lifestyle changes that are within almost everyone's reach can make a huge difference. The RAND organization came out with a statement several years ago that said as many as 40% of Alzheimer's patients could be normalized, right? Potential people at risk could be addressed if we develop some of these risk policies
Yeah.
like nutrition,
Yeah. Yeah.
good exercise protocols,
Yep.
and good sleep.
Yep.
These are all things we can do. It doesn't mean, nutrition. I'm like, let's not make it too complicated for people.
Yeah.
Some people like the Mediterranean diet, the mind diet, and all this. I'm like, I don't like olives, so you like cut me out right then. But tell people,
Yeah.
all you gotta do is make sure you've got some different colors on your plate.
Exactly.
If it's
Exactly.
rice with turkey, with gravy, with mashed potatoes, that's not a good.
Not, no.
Tastes yummy, but do some sweet potatoes on there. Put some
Yeah.
fruit on your plate. Just make
Yeah.
it colorful. You need to sleep 8 to 10 hours a night. It's okay
Yeah.
to do that.
Yeah.
Cut the
Yeah.
screen time. Make it accessible to people. That's what we need. So
And
I would love to see communities and doctors talking about how we prevent
yeah.
from having to see them and then have these, correct things. Once you do have a symptom, then we can come in and we start testing you early.
Yeah,
People
exactly.
don't know at age 65, if you're going on Medicare, you're entitled to a Welcome to Medicare study that involves checking your brain,
Yeah.
right? Just to see, so you at least get a baseline. So when things start to change, we can see that. But a lot of people don't know, and the doctors aren't just
Are
volunteering to.
not are not talking about it. That's something that we're doing in diverse research now. We're out in the community doing brain health talks at senior centers, or one of them is at the Salvation Army. They have a group of seniors that come to their center. A good idea is to partner with these centers. And a
Absolutely.
lot of times these centers have brain health activities that are good for your brain, the exercising, the crafts, the social
Right.
interaction. All these things are so good for the brain, which is why we go to those facilities and share with these seniors like, hey, yes, you guys are doing all the right things just being here.
Right.
And they need to know that because they don't know. They don't know. And the other thing, prevention is huge. Prevention is huge. So that's why it's so important to share this information as early as possible too.
Uh-huh.
I think some of the Alzheimer's studies are trying to get in people as early as 50 now, or maybe or like 55.
We need to be going to like college kids. Like I
Yeah,
said,
yeah.
this is
Everybody needs to know,
develop
like,
those
because it's so,
develop those good habits.
yes, that's it. It's
Like
developing the
AI
good habits.
suggests that it would be good even for churches to think about not every meal, every Sunday dinner, but you don't have to have fried chicken and fried
I
fish
know that's
every
right.
Sunday. You could say healthy food tastes good. Like let's
No,
experiment
we
with
do
making
not have to have
healthy
fried
food.
chicken at every meal. That is
Right. Fried fish. But,
so right.
there's so many places and ways that we could take control of
Yes,
our health and
yes.
not wait for others. And I'll say the final thing it involves really, and what I've had to do with my dad is using my voice.
Mm-hmm.
Using my voice to make sure he is getting what he needs to get, questioning the doctors. Why is he getting this
Mm-hmm.
medicine?
That's
Why do y'all
right.
still have him on high blood pressure medicine when every morning his blood pressure is like 120?
Yeah.
Let's take him off of that.
Come on. Come
Why
on.
is he still on diabetes medicine when he's like had hypoglycemia and his stuff is too low? So we have him down from 14 medicines now. And I'm just saying this is for our family because I track it and my brother happens to be a doctor.
Uh-huh.
14 medicines down to 4 a day. Might be
Wow.
why he's doing so much better. Because
Oh
all these
man.
medicines, they do stuff,
They do
right?
stuff. That's right. They
Do
do. They
stuff.
cause other issues.
Yeah.
Yeah. Yeah.
I'm pro medicine, but I'm pro the medicine at the right time, at the right dose. That's been proven for us.
That makes sense. It
Yeah,
has to make sense. Not just
based on
taking
data.
medications. Yeah, not just taking medications because your doctor said it. I mean, this is all about advocacy. I mean, that's one of the things
Yes.
we kind of preach too is advocating for yourself, paying attention to what is going on. Even if, and I know some people don't have support. Like your dad is so fortunate to have you and your brother. And unfortunately, a lot of people in our community don't have that support.
Yeah.
But there's organizations out there that will help. We're an organization that kind of focus in on research, but there's other advocacy organizations that will help people in this way, help to manage their health journey, you
Yeah,
know?
I think people are starting to stand up. We see more sort of, navigators,
Yes.
people that will actually assist. There's another organization called Trusted Riders that will actually provide transportation to people to the
Hmm.
hospital, back from the hospital to
Nice.
clinical trials,
Nice. Oh,
right?
good.
To help them get there and to stay there.
Oh,
You know,
good.
I don't know if any of y'all have ever been to one of these big academic centers. I go to Johns Hopkins.
Yeah.
You need a GPS to get through that system.
Yeah. Yeah.
So having someone who meets you at the door and just makes it easy for you to get to yes, to get up to this place where you are, find parking, not have to pay for parking. I mean, those are the things that our
Yep.
communities we can be advocating for to say,
Yep.
I want to come in, I want to do this, but I can't get there. I'm not taking public transportation.
That's what I'm saying. Like, we're all about giving the participants pleasant experiences. If you're not going to have a pleasant experience, you're not going to want to get involved.
Or you'll get
So,
involved and you'll drop out, and that's like double the expense.
exactly,
Yeah.
exactly. So that's why we have the programs that we have where we talk to people one on one. We actually will go to visits with them as their advocate in this space. So they're feeling comfortable where they have someone that's there with them. They're not doing this alone. So we definitely that it means so much.
You are meeting people. You're doing a wonderful job because you're
Mhm.
meeting people where they are
Exactly.
and not trying to bring them where you want to go. So I
Exactly.
hope you'll count me as a partner. I really want to help
Ah,
in whatever way I can because these are issues that are just so critical. Our
yeah.
community's health is really dependent as a community on the community
Yeah.
to come alongside one. We in Baltimore, one of the things I loved about growing up in Baltimore is that we were a very neighborhood focused place. If I go walking down the street when I was in high school or younger, misbehave, my mom knew before I even got home. And if you had an elder person who needed something, we were bringing them dinners. We were doing all of that. The sick and the shut-in visitations,
Yep.
not just belong to the pastor as a
Yep.
responsibility. We see someone, and actually, it was an interesting story. I'll tell you this. My mom, at one point, one of her good friends was in church and she would see, and she just seemed off. A couple church visits, and 3 or 4 of them got together afterwards and they said, "Doesn't she seem off?" Yeah, she seems off. And they called the pastor and told him, and the EMTs came and checked her out, and her blood pressure, like she was almost in a coma state.
Oh,
But
shoot.
because she
Okay.
is out and people were accountable, they
Yes.
did not mind getting fussed at for being nosy.
Yes.
It saved that woman her life.
Oh, wow.
So,
This
so
is
I
what we
just,
need. Yes. We have to take care of each other.
absolutely.
It's so important. I hear all the time, yeah, no one's coming to save us. We got to save ourselves.
Yeah, that's sometimes true.
Yeah.
Sometimes people say everybody's got their own boat. You don't need to let them jump in your boat all the time. And I'm like, I'm sorry, I'm a caregiver at heart. Probably my boat has gone under and flipped over a couple times with people. But I'm like, my dad doesn't have a boat. That
Yeah.
I love. People are like, oh, it's so hard taking care of your dad at home. And I'm like, it's a blessing.
It's a
And
blessing.
he is
I love
88 years
that.
old
I love that.
and he has had so many challenges. He has been there. So just honoring him. I'm not going
Yeah.
to let him go somewhere else. If you
That's
ever want to do a research on caregiving, you can bring me back on and I can tell you
okay.
some
Okay.
of the
Yeah, for
bad
sure.
experiences that I have seen with people. Sometimes the families have to do that because they don't
Hmm.
have the ability.
Hmm.
But I was blessed that I had the ability to bring him in. And it just makes me feel good every day to
That's
see him every
awesome.
day.
That's awesome. So, okay, we'll finish up, but the last thing I like to ask our guests is what would you want to leave with the community? I know we said so many good, rich things today to share with the community, but anything else you want to share with the community as it relates to like getting involved in research and or even anything that you have and anything you want to share with the researchers and doctors that are listening, because we do have listeners from pharma and other sites, clinical trial sites. What
Right.
would your message be to those two?
So, to the pharma companies and especially academic institutions, I would
Mhm.
say our population, Latino populations, and others, especially those who are not English speaking, we are not hard to reach. In fact, we're 47% of the population, so we are everywhere.
Come on.
If you're not reaching us, you haven't wanted to reach us.
Come on.
You need to ask the community what they want. You don't come into someone's home for a party without bringing a gift,
Come on now. I
right?
love
So
that.
bring to the
Love that.
community and ask them, what do they need? They don't need a savior. They don't need someone parachuting in your idea. You need to ask them. So if you're an academic institution, you come in, you want to talk about brain health. Maybe the community is like, you know what, we got a lot of HIV AIDS here. You can talk about that. You can grab one of your other partners to come in and talk about that and
Exactly.
pivot. You want
Exactly.
heart disease? What's good for
Yep.
the heart is good for the brain.
Yep.
All these conditions impact the brain, and the brain impacts all of it. It is the engine, but you need to use your brain to reach these communities in a way and include them on your advisory boards, include
Yes.
patients. Make
Yes.
sure you're hearing from the community and that they are telling you what's appropriate, not appropriate, what brochures, how they want to communicate. When I did the play, there were some communities where the community wanted to throw up, not the community, but the entity that was sponsoring us wanted to throw up ads on a bus. I was like, do you think people riding a bus are going to take notes on the bus? No. Let's go to the FM radio. Let's go to the jazz radio,
Yeah.
right? Let's
Yeah.
do word of mouth. Let's find out and
Right.
communicate with them the way they want to receive.
So knowing your
And,
community, knowing the community that you want to touch is so
right.
important
And don't just
because,
come in with the ask. You
yeah,
might need to go to church a couple Sundays
exactly.
without thinking the pastor's going to let you have access to his pulpit.
Yeah.
No, that's not going to happen.
No.
So you better figure out the first lady or who's the person that has the most influence and then work with them.
Yeah. Yeah. We're definitely all about being in the community and we live in the community. I mean, that's where we are and we're there often. I say
Absolutely.
that all the time is that you have to be consistent. It's
You
not
do.
just about coming in. And I'm hoping
If
that
you
they're
come
getting
in and you leave, that's worse than not coming in at all.
right, right, exactly. And that's what I'm hoping that that's getting across because I feel like we've been saying that so much, like so over the years. Like that's been said so much, and I'm hoping that they're listening.
And I think when we often are asked to come in and help, it needs to be a two-way street. They tell us what they need and we tell them what we need for us to come in.
That's right.
We want you at the table, but here is XYZ that we want you to do. We might say, we want you to hire a navigator who is already embedded,
Yep.
who is responsible to report to you, and they will be sending the message and keeping that community connected.
Yep.
Don't have to bring in someone who's from outside the community. Let the people who are trusted, like nurses, be the people in your spokesperson there.
Yep. I love that.
For patients, caregivers, healthy people, old people, young people, when it comes to your health, you're in the driver's seat. When it comes to information about what you need, you've got to ask. You can't wait for someone benevolence to share with you what you need. When you go to the doctor, and I do this now, I take a list of the questions I have that I thought about. It's sort of like the time you take your car to the car shop and whatever it was supposed to happen, it's not
Uh-huh.
happening. All of a sudden, it's healed itself.
Uh-huh.
You have to remember, make a list of the questions that you want, or concerns, or the feelings, the pains, whatever that you're concerned about. Keep a log. Go ahead and do that.
I
Put it on
love
your
that.
phone. So that when you come in, it's not just ear, eyes, mouth, nose, throat.
Yeah.
You talk about, hey, is this normal? Is that normal?
Yeah.
Or, hey, my mom has this. You can be that informant to
Yeah.
ask questions and then bring your loved ones in with you. And if you need to take a loved one with you, just to be there, to be those additional, I take my daughter with me as often as she wants.
Yeah.
So she can hear what I'm hearing, because
That's
they
right.
might say something and then they lost me at hello.
Yep.
Everything came after that was not something I wanted to hear. So don't be ashamed to include other people. Don't be
Love
so
that.
private. And men, listen to your wives
Yes.
or your
That's
girlfriend or your mama,
yes,
whoever.
to the woman.
Yeah, to the woman, because she is the CEO of health in your family.
Yes, I love that. Thank you so much, Stephanie. I really appreciate your
So,
voice and such a powerful voice.
Thank you so much.
We hope to have you back on at some point, but we appreciate your time today. Thank you so much.
I really appreciate being here. Thank
Okay,
you.
okay. Bye-bye.